Welcome everybody to this week's Power Hour. We are going to talk about health behaviors today, and we're very excited about the group of guests that you're going to be meeting in the Zoom studio today. With me, I have my colleague Danielle Snyder, and also, as always, the Power Hour is moderated by our eminent colleague, Franklin Walker. Just as a reminder, this is a recorded session, and this session is going to be available about next week sometime on the KIPL landing page for the Power Hours. And as we ask everybody to stay on mute, you are welcome to also unmute and ask questions to the guests as the conversation proceeds. And just as a final reminder, this Power Hour is all about conversation, collaboration, and above all, community. So thank you so much to our guests, and thank you for those of you who are able to be here today with us in the audience, and also for those of you who are going to be downloading this afterwards. Without any further ado, Franklin, I'm going to hand it over to you.
Thanks, Tina. Welcome everybody to another edition of Power Hour. We're glad to have you. We're looking forward to talking about healthy behaviors today with our panel, as Tina said, which is great because I think spring has sprung. We've seen a lot of great weather here in North Carolina, despite the little cold snap we've had. So let's get into meeting our guest first. I want to go around, and I would like each guest to give me your background on yourself briefly, and then your organization that you represent. And Anu, I'd like to start with you, please, ma'am.
Sure. So before I start, I just wanted to say thanks for having me today. We appreciate being included. So I'm Anu Rao-Patel. I am one of the lead medical directors at Blue Cross over care management and our government programs. I'm fairly certain that all of you have at least heard of Blue Cross. And as far as Blue Cross North Carolina, we're one of our state's largest insurer. We have members in all 100 counties. There are other Blues plans across the United States, and we all generally fall under the Blue Cross Association, but are different in terms of whether we are for-profit or non-profit, and we are a non-profit. We have many different lines of business at Blue Cross. We have, of course, our commercial. We're still in the ACA. We have a federal employee program. We have a Medicare Advantage, and we're also one of the PHPs with managed Medicaid with our Healthy Blue line of business. So again, that's a little bit of background, and thanks for having us here today.
Super, thank you. Cynthia, how about you?
Hi, good afternoon, everyone. Thanks for having me as well. My name is Cynthia Gary. I'm a physician assistant, and I currently work at the Johnson County Health Department, which is in Smithfield, North Carolina, just east or so of Raleigh, for those of you that are not familiar. Before I was a physician assistant, I was a health educator at Franklin County Health Department and did a lot of community work. The Franklin County Health Department is a health department like you're all familiar with, but some key differences that a lot of health departments don't have is a primary care, and also a primary care for pediatrics. So that is a bit different for us, and all of the clinics are quite different. However, now with COVID, we have shifted a lot of our focus to that response. And today, for instance, we're doing one of our mass vaccination clinics, which we have been doing quite a few of over the last several weeks, and we have a few more planned, and also are doing still testing and vaccines in the clinic.
Super, thank you, Cynthia. And then we have Michelle Hughes. Michelle, how about it?
Hey, thanks for having me. I'm Michelle Hughes. I'm the Executive Director of NC Child. We are the state's only nonpartisan multi-issue policy advocacy organization for children, which means that we work closely with the state legislature and with Congress to ensure that the policies that they are considering and working towards are good for kids, that they're pro-kid, pro-family. And so we work on a number of different issues related to child health and well-being. We really take a whole child approach. recognizing, we often say we need to put the mouth back in the head back on the body. It takes all of those pieces of kids to be healthy and well. And we also look at the environments that children are growing up in. So we do a lot of work on poverty, lead poisoning prevention, and other things that really impact children's development. And it's a pleasure to be here.
Super, thanks. Okay, so let's get into talking about healthy behaviors. And I think for a general definition, people would assume that nutrition and getting good sleep and exercise are part of healthy behaviors, but there's a lot more to it. And so I think before we delve into this discussion, we really need to define what you all, our panelists, or how you're defining that, okay? So Anu, I want to come back to you and get your views on how we can define healthy behaviors from an insurance company's perspective.
Sure. So, so I'll say as a physician and from a health insurer's point of view, I think it's all about taking steps to stay healthy and preventing illness. And in the situations where we have chronic illness like diabetes and COPD, it's to prevent furthering of the illness or getting more sick, and managing those conditions. So to your point, you mentioned, healthy eating. So I'm sure we'll talk about these things today, includes things like healthy eating, exercising, making sure that we keep our appointments with our doctors. If we don't have primary care doctor who can manage our conditions, then it's important to find a doctor, making sure we're keeping up with preventive care. And like I mentioned, managing chronic conditions. And when I say chronic conditions, I'm talking about both behavioral, mental conditions, as well as physical conditions.
Super. Cynthia, I'd like to come down now to you and get it from, a public health perspective, please.
Mm-hmm. So everything that was just mentioned, I agree with in terms of specific actions that individuals can take to help themselves be healthier, such as diet and nutrition. However, working in public health with our patient population, you quickly realize that individual desire to be healthy isn't necessarily everything that there is to creating healthy behaviors. It really is a holistic social perspective. So for instance, there are patients that I work with that have chronic illnesses, are on specific medications, have been educated about healthy diet and exercise, that type of thing. However, there are just so many social issues that they are dealing with that just make it difficult for them to be able to do that. So if we really want to discuss helping people to take on healthy behaviors, then we have to understand the environment that they're in and some of the challenges that they face.
Sure. And then Michelle, I want to get your input on this question, particularly as the executive director of NC Child. Let's think about a policy lens when you're answering this question, please.
For sure. I think building off of what Cynthia just said, that, for children grow up in families, and families thrive or don't thrive in community. And so when we think about how do we best support children's healthy development, how do we best support healthy behaviors with children, healthy choices, we really have to look at it within the context of where they're growing up. So their families and their communities that they're living in. And if their families are struggling, children will struggle. And if families are struggling in community, all of them will struggle. So healthy behaviors are impacted by education and experience and environment. So what I might have for my choice, or my child might have for a choice of healthy behavior, that is not the same for other children. And so I think public policy is the lever that NC Child focuses on, because we know we can make population level differences. We can change the environments that children are growing up in, and we can change and support what resources families have access to through public policy. So things like making sure that families have health insurance, we know that children are much more likely to be insured if their families have health insurance. And right now, even though North Carolina has about 95% of our children are insured, that number has actually been decreasing over the past few years, and we're very worried about it. And so passing Medicaid expansion, closing the healthcare coverage gap, that is a policy tool that will in fact support children's healthy behavior and healthy development.
Super. That's a great point, that last point. And I want to get into something else you mentioned. All of you mentioned this common theme, nature versus nurture, family versus community. And it seems to me that, of course, all those have to align properly to get your best outcomes, right? And so, Nu, coming back to you again, you guys are in families, you insure individuals. I get my health insurance through Blue Cross Blue Shield, as does my family. And then you influence communities a lot of times through your foundation work. And again, the Medical Society Foundation has a lot of good stuff that they've done over the years with Blue Cross Blue Shield Foundation. So could you talk a little bit about Blue Cross's areas of influence, both maybe at the personal family level and at the community level?
Sure, yeah. So, one of the things I'll mention is that we have always encouraged healthy behaviors, and I appreciate and understand, we understand the disparities that exist, and that we have to account for those things. And so we've always emphasized, like I mentioned, the importance of things like preventive care. So we cover things like routine preventative care at 100%, things like your physical, your mammograms, counseling support, smoking cessation. We feel like it's super important, again, for us to align with others in the community. And for that reason, I actually have taken notes so that I can make sure to include all the things that we have done. We have looked at focusing on improving access to care, making sure that healthcare is better, trying to make it simpler and more affordable. And we realize a lot of that is through our collaborative relationships with people in the community. So some of the companies, for example, we're collaborating with to improve care are Caravan Health, to expand our value-based care into the community and rural hospitals. Quartet, for example, to integrate mental health into primary care. Looking at things like chronic diseases, Virta, for example, trying to reverse type 2 diabetes, as well as an organization called Carrot to really help people quit smoking. So a lot of the things we do in the community are to fund programs that address the drivers of health, especially looking at people of color, things like food insecurity, early childhood development, housing, social isolation, and transportation issues. So to date, I would say that we've invested close to $2 million to diversity organizations. Some of that is like March of Dimes and El Futuro, for example.
Super. And Cynthia, I'm coming to you next to get it from, again, the public health department perspective. And maybe you can give us some examples of your work in Johnston County, both with the families and then in the community.
Okay, so we do have health educators at the Johnston County Health Department, and there are a variety of programs that they take on in the community. Again, now during the time of COVID, they are shifting most of their focus towards that. However, prior to that, there were parenting programs, smoking cessation, lots of diet, nutrition, community programs, working with different organizations and churches. And those are a lot of things that are done in the community. In-house, working with individual patients is much the same type of education. So like I mentioned earlier, my background is in health education. So that really informs everything that I do. And I'm extremely grateful that I have that background, because when you're working with patients, it's not just necessarily giving them information and prescribing medication and explaining how this medication is going to help them. But again, trying to explain to them their ailments and their chronic illnesses, and also explaining wellness and health to them. So for instance, sometimes in a conversation with a patient, they may come in for a blood pressure check. And I spend the majority of my time with them really talking about social issues and talking about their goals. That's a big one. You know, it's one thing for a provider to have a goal for a patient, as we all do, but it's very important to find out, you know, what is your goal? Because I had a patient that I was seeing for quite a while, several months, probably even a year, and not a lot of improvement in terms of their health. So then I just had to take a step back and say, okay, what are your goals? Where do you want to be in 5 years? And that completely shifted the conversation, and it really made their wheels start turning into thinking, okay, now it's starting to make sense. Now I'm understanding my health so that I can be around for my children and my grandchildren, and so that I'm not in pain as much. So as an individual provider working with a patient, that does impact the community, because what you say in the room with a patient, it goes out to their family, and then it goes back to the community.
Right. There's a multiplier effect is what you're speaking about. I want to give you a follow-up question too. It's based on another answer you gave prior to this one, when I think you mentioned social determinants or social drivers, et cetera. And your career as a health educator, have you found over the last several years that you're spending increasing amount of time educating about social determinants and inherent bias and those kind of things that seem to be more at the front of a lot of conversations that we're having in general?
Well, what I find interesting is that, like you just mentioned, it seems recently that it's at the forefront of a lot of conversations. I find that surprising, because when I started my career as a health educator, it was already at the forefront of our conversations, a couple of decades ago, to date myself. So we were already talking about all of these social determinants of health. And as a health educator working with people, it was just very interesting, because they would often come to me and tell me about their medical issues, and I wasn't a PA at the time. And I would ask, did you mention it to your doctor, to your nurse? And they say, well, no, I didn't think they would understand, or they don't really understand where I'm coming from. They don't understand the things that I'm dealing with in my life. And I just, so it's always been an issue. Now we're starting to have more conversations about it on multiple levels, which is great. However, it's not new at all.
Right. Yeah, that's interesting. Michelle, I haven't forgotten about you. I want to give you a chance to chime in on the question that we had posed to the other two. So from your organization's perspective, please let us know.
Sure. And so tell me a little bit, just from a policy organization, is there something specific you'd love to have me dive in on that question?
I think the social determinants, the follow-up question that I asked Cynthia would be great, because again, I just think, she made a great point that 2 decades ago, it was in the front of what they were learning and doing, but society now has opened wide open to these kind of discussions, which I think we need to have, and it's great. And I know that the medical society has put that at the top of some of the drivers of what we're doing programmatically and policy wise. So from your perspective, yeah, please.
Sure. So I'm a social worker by training. And so I love the start where your client is, the perspective that Cynthia just said, which is great. But I was a social worker who was always really interested in policy and systems change. So I did the clinical work for a little bit, and then I think quickly realized when I had 4 Black boys in foster care that was part of a guardian ad litem internship that I was doing who had been in foster care pretty much their entire lives. And that what got those boys into foster care, what were the social determinants that they were growing up in? It was the poverty of their neighborhood. It was the racism that their families had experienced. It was the trauma that their mom had experienced and it was untreated. And all of those things ended up impacting those 4 little boys and their lives. And yes, the services that we were delivering to those kids were really important. And we could have prevented those 4 little boys from being in foster care in the first place if we had looked at the environment that they were growing up in and prevented sort of a lot of the environmental and social influences. So from NC Child's perspective, policy is a really important lever to address the social determinants of health. And when we look at how do we get better outcomes for families in terms of their health and children, really from our perspective, policy changes that impact not only their access to health services, but policies that change their environment. So their access to quality early care, the access to quality education in their public school system, direct cash assistance that help their families be less stressed because less stressed parents are better able to take care of their kids. Those are some of the policies that we think are really important that eventually lead to better health outcomes and better health behaviors for kids and families.
Super, thank you. Okay, I want to come back and talk a little bit and kind of transpose pre-COVID versus going into COVID. And we'll talk a little bit later about maybe emerging out of COVID. So Anu, I want to come back to you. And I want to talk about it from a Blue Cross Blue Shield perspective. What were you guys doing before March of 2020 when the state basically shut down because of COVID to encourage, healthy behaviors, both, in your payment structure, maybe to physicians, your working community? And then how did that change as we went through last spring?
Yeah, so like as I mentioned earlier in the call, I mean, we've always stressed the importance of preventative care. I mean, that's super important. I think, just as a physician myself who was previously seeing patients and still sees patients part-time in addition to my role at Blue Cross, I mean, it's better to put out the fire than to try to put it out, then it's better to prevent the fire than to put it out once it's started. And so a lot of the issues that we've been talking about so far on this call are things that Blue Cross recognizes and has tried to focus on. It's interesting because, once March came around and then, we were hit with this COVID, we realized pretty quickly that a lot of things got shut down because of quarantine, which meant that a lot of doctors' offices were closed temporarily, and, a lot of elective procedures stopped or were put on hold at least. While we tried to navigate that time period and find a safer way for patients to continue to see their providers. So we really were one of the first insurers to put policies into place to make access to care better and easier, and that included telehealth. So one of the things that we did was waive cost share for members for COVID-19 related testing and treatment. We expanded our telehealth policy to cover both phone and video visits as if they were similar to face-to-face. So we were paying providers the same. We've actually extended our current telehealth policy through the end of the year, and we'll continue to pay providers at parity as if they are seeing the patient in person. Again, when COVID-19 hit, we may touch on this shortly, but we encouraged members to continue to find care in a way that was comfortable and safe for them. And initially, of course, when all this happened, we saw a little bit of a dip in claims. In other words, people had stopped going to the doctor for various reasons. Either their doctor's office were closed or they were scared to go in person to get care. But then levels normalized after some time. By the fall, And actually this December, we probably saw the most number of claims and healthcare costs that we've seen in decades.
Yeah. Yeah, it's really been an interesting journey for sure. And it makes me want to talk a little bit more about access, but I want to ask Cynthia that same kind of question. Pre-COVID, then coming into COVID, what did you guys do in order to change healthy behaviors, access, that sort of stuff?
So we started to limit visits, and which of course impacted patients because a lot of appointments were canceled, and there were certain ones for children specifically. We focused on them to make sure that their appointments were still in place. But for some other visits, we had to really start triaging more. So a lot of appointments were canceled and started limiting services so that we could use staff to help with the COVID response. And also we started to implement telehealth, which we had not really done before. And that was a learning curve for most of us. We're actually still using it. A lot of our patients really appreciate being able to still have contact and still be able to talk about their health issues and making sure that they can talk to us, get their prescriptions filled, that type of thing. Some patients don't like telehealth at all. They may have tried it once or twice, but then they say, when are we coming back to the office? When will I be able to see you in person? Will I ever be able to see you again? So I don't know the exact percentages, but we hear it on both ends. In our mental health department, they're still doing primarily telehealth visits, and that is going really well. So that's been one of the biggest changes. It's just trying to manage patients and making sure that they're able to get what they need during this time.
Do you think that your patient visits, both virtual and in person now, have returned in some back to where they were pre-COVID? Or are you still down in terms of your patient visits?
The patient visits are not quite where they were pre-COVID, but probably closer than they were a few months ago.
Still coming back. Yeah.
Right, but there are still some, like for instance, in primary care, we are not seeing brand new patients right now. So that's one of the things that are different. So it's not quite back up to 100% of what it was pre-COVID.
Right, right. Michelle, I want to come back with that question to you in terms of what you guys were doing pre, and then as you moved into COVID, like the rest of us, what were the changes that might have been happening where you are in terms of policy?
Sure. In 2020, so 2020 in North Carolina is a legislative, what they call a short session. So it's usually May through July, May through part of the summer. And usually typically is not a huge year for legislative. It's not the year we introduce big pieces of legislation. So we sort of came into 2020 thinking, short session, we're going to be working on these other kind of things during this year. And everything just completely switched in March and April. And we went into high gear COVID relief at the legislature. And so we worked with a lot of partners on a lot of different issues. A couple of the main things folks have actually been talking about here is really loosening a lot of the regulations and a lot of the requirements, both for federal and state programs to increase access for families and for kids. So the WIC program, SNAP program, food delivery within schools, the federal government did a lot of allowances that kind of loosened up some of those regulations. And we wanted North Carolina to take advantage of those. And North Carolina did, which is great. We also recognize that a lot of the systems that serve kids that were already really fragile in the pandemic almost collapsed. And so a good example is North Carolina's early care and learning system, the child care system. Like every other state, It's a very, very fragile system financially. We can talk about that, but the pandemic almost forced the collapse of the early care system. So families were not losing jobs and either not able to put their children in childcare because they could not afford it, or they were worried because of obviously the virus and transmission, and were keeping kids at home. And so childcare providers, which operate on tuition from parents, all of a sudden experienced a huge loss of revenue and were closing. Most of them closed at the beginning of the pandemic. So our job at NC Child was to try to get federal and state funding, emergency relief funding, basically directed to childcare centers across North Carolina, and with many, many partners. And I'm glad to say that at this point, about more than 90% of the centers and programs are open again because of that funding. But again, we are continuing to see the impact of the pandemic, and the funding from the American Rescue Plan that is coming to North Carolina will go a long way for, just as sort of to give a sense of the size, North Carolina has $1.3 billion for childcare coming to it this year to help support these programs and help them reopen. So it has been COVID nonstop. And I think the big issue, or a couple big issues that we're worried about right now that I know folks on this call are worried about, is just the delay in services to children or missed appointments with kids. So drop in vaccinations, missed developmental screenings, which means that children with different developmental issues are not being identified early to get them into early intervention services, a missed opportunity. And then of course, the really concerning increases in child depression, anxiety, and suicidal ideation. This is an enormous issue for our kids in North Carolina, and something we all need to be really worried about.
Yeah. Well, that's great work that you guys did. And I know that the Medical Society's advocacy team was working along with you guys to get some relief for medical practices, which we got out late last year, and we need to do that again. So again, kudos for you for doing that. Okay, let's talk about vaccines for a minute. And I think I'll only speak for myself. This is not a statement for the North Carolina Medical Society, but I would think that getting vaccinated is probably a healthy behavior in the current environment, okay? So I'd like to hear from my panelists one by one, your thoughts on the vaccine. Is that a healthy behavior, and what you guys are doing in your roles to promote that, okay? And Michelle, you're right there. So why don't we start with you?
Sure. Oh, it's such a complicated issue, isn't it?
Very complicated.
Yeah, I mean, I think for us at NC Child, our biggest goal is to ensure that children's lives in 2020 have been completely upended. So any sense of normalcy, routine, all these things that go toward healthy development of children have been lost for so many kids. And so school, isolation, lack of community activities, I mean, all these things have really impacted children and their development, as I mentioned. And so those things that we can do to ensure that kids are getting back into the normal routine as soon as possible, and vaccinations are a piece of that. And so, for example, one of the things that we were, really advocating for is the prioritization of early care and learning teachers to get vaccinated early on, so that, again, early care and education never closed down in the sense of where public schools were shut down early on and have been reopening slowly. Childcare centers never closed down for the most part. They try to stay open. And those teachers often don't have health insurance, and they make $12 an hour. So if you need folks vaccinated, it's early care and learning teachers. And so that was an example of, like, the quicker we can get folks vaccinated, the quicker then we can get kids back into schools and childcare centers and community activities that really foster their healthy development.
That's super. Cynthia, how about you?
Vaccinations in general, I think, definitely are a healthy behavior. when we're talking specifically about the COVID vaccine, I agree with Michelle. It's such a complicated issue, and it's the big battle of the individual versus the public's health, and that's what you're seeing and hearing a lot of. At the health department, obviously, we're having vaccine clinics. We started having mass clinics maybe back in January or early February. And that's how we're promoting it, is through access. And we were trying from the beginning to make sure that the people, of course, starting with the senior citizen population, that they were able to have access to it through the mass clinics and not having to have appointments and go through, because initially, it was quite complicated to be able to sign up and get appointments, and locations were extremely limited. We had people coming, it wasn't just for Johnston County. We never restricted it just to Johnston County. And initially we had people coming even from different states and several counties to get the COVID vaccine initially. So that's how we have been promoting it. And of course, it was always available to employees, to county employees. But it is a complicated issue because, and I'm sure we may talk about a little bit later in terms of health education and how it plays a part in, discussing vaccine hesitancy. So in general, yes, vaccines are extremely important, and our vaccine rate in Johnston County has always been quite high, especially with our children. But with the COVID vaccine, it does complicate things a bit.
Sure. No, it is a complex issue. You mentioned your mass vaccine events and that you guys have been, I think, fairly successful, and you've had a lot of folks come see you. Do you have any idea how Johnston County Health Department might compare to the 84 other local health departments across the state in terms of, how busy are you guys comparatively to them, to the other health departments?
Mm-hmm. I am not as familiar with what other health departments are doing, but I can say that all of our clinics have been extremely busy. It's probably only the last clinic or two that has been showing a decrease in the amount of people that are coming out. And we think that's just mainly because there are other options now, such as at pharmacies and at some of their physician offices that are offering appointments for the vaccine.
Super.
But
yeah,
all of the clinics have been extremely busy.
Yeah. So you have plenty of supply at this point.
Yes.
Okay.
Yes. So that lately has not been an issue. Supply has been there.
Okay. Super. Okay, Anu, I'm coming back to you to talk a little bit about the same question, if you don't mind.
Sure. Yeah, I echo what Cynthia and Michelle said. I think I believe that vaccines are good for public health and individual health. I think there's a lot more hesitancy, or there has been, around the COVID vaccine for a multitude of reasons, of the fact that the messenger RNA technology is newer, and I think maybe some contribution of social media to elevating these concerns, and then of course it doesn't help what happened with the Johnson & Johnson vaccine. I think there's supposed to be a decision today actually about that. So I think there are a multitude of factors that have contributed in general to vaccine hesitancy. I think we've had at Blue Cross our own employee health vaccine clinic. Originally that was scheduled with the Johnson & Johnson vaccine until they put that on pause. And now I believe they're offering the Pfizer vaccine. So we've had one vaccine clinic for employees, and there will likely be others as well. We've really tried to implement a couple of strategies to educate the public, members in general, everybody, to remove barriers and have an uptake in vaccines. One of the things that Blue Cross recently did was invest some money into Ride United NC, which is really to cover the cost of 5,000 rides across North Carolina for people to get transportation to get their vaccine. So trying to eliminate that as a barrier, the fact that people can't actually get to the location to get their vaccine. We also have case managers. So when the case managers make outreach, they will call Blue Cross members and assist in raising awareness about the vaccine, try to alleviate any concerns, answer any questions, and provide information about vaccine locations within North Carolina. We've also done targeted emails to members who have indicated that they're eligible, or the eligibility shows that, well, now everybody's eligible, but at different phases of the vaccine rollout, we would target emails and make outreach to Blue Cross members to basically help them and guide them to get vaccines if they were interested in doing so. We also will be launching, we talked a little bit about health discrepancies, and we've heard in the news and in general about vaccine hesitancy, especially among communities of color, brown and Black and Hispanic communities. So we'll be doing some targeted social media campaigns to help educate and alleviate the concerns and the fears that these communities understandably might face as well.
Yeah, that's something I wanted to talk to all of you guys about, not just the vaccine hesitancy, but the main thing there, at least from my perspective, is the lack of trust or mistrust or the disinformation that's been out there in the public sphere. A lot of it due to the media, as we know. And, I'm not going to tag you with this, Anu, because you kind of just answered it, but I want to come back to my other two guests. Michelle, is there anything from a policy perspective that you guys are doing to overcome that hesitancy, not just with the vaccine per se, but with establishing trust with the folks that you need to get the message to resume their healthy behaviors?
Sure. I think this is also a complicated answer to this question. So I think that, I think two things are important, and we are working on it, and we are far from perfect. So this is a journey. One is that our systems in North Carolina, and pick a system, healthcare system, education system, juvenile justice system, child welfare system, any systems, have inequities baked into the system. There is systemic racism within all of our systems that we have built, and there is hesitancy from community members to be involved in those systems because of their own experiences in those systems, which often are not very good. And so I think we have to recognize that changing those systems, understanding, again, everything from what you said, Franklin, implicit bias to the policies and the practices and the culture of the systems that are not friendly or not hospitable, and that in fact can be discriminatory to the folks that are trying to use those systems, I think is really important to recognize for all of our work. And it's something that we're very focused on at NC Child in terms of dismantling systemic racism in the systems that we're working with, which of course is a very big topic there. I think the other thing is always starting with the voices of the beneficiaries, of the most impacted individuals. A lot of times, I will say state level advocates and folks working at the state level design systems, design policies that are with the best intention of serving the community. But if we don't design those policies and systems, starting with the experiences of people most impacted by that policy and that system, and the voices of children and parents and teachers and community members in the design, then we often miss we miss an opportunity, and we often miss the shot. And so those are sort of two things I think that are really important that we've been working on, increasingly developing a policy agenda and advocacy work in partnership and driven by the community, because that really we feel is has the most integrity, is the most genuine, is the most authentic, and probably will get us the best results as well.
That's super. I want to second some of the stuff that you just mentioned, because again, Medical Society, we've done a lot of work in the last 6 to 8 months in examining our work through an equity lens. We did some training with the Racial Equity Institute, which was so powerful. I know Tina's embedded some of her work in the KIPL Institute to look at this stuff. We done, I think, 5 or 6 sessions of Power Hour on racism, systemic racism, and racism in healthcare. And so anyway, we're all in on this. So thank you for being in on it as well. Cynthia, I want to come back to you and give you the last chance to kind of address that question that we've been talking about.
As far as with vaccine hesitancy.
Yeah, overcoming the trust and what maybe you
Overcoming it.
guys are doing from a messaging standpoint down there in Johnston County.
Well, again, going back to how complicated it is, as an individual provider, I have had a few patients to ask. And what's most important is that we are truthful with our patients, that we're not necessarily trying to advocate for one thing or the other, but that we give people the information that's actually there, and also giving them resources of where they can go and obtain more information. Because there are a lot of people, not just patients, but people I know personally that are asking questions, and they say, well, it's been approved, right? It's been approved by the FDA. And so then I explained that the emergency use authorization. So people are not even really clear on that. And then when you explain that to some people, they take a step back, and then they are even more hesitant because they say, wait a minute, that's not what I thought. Yeah. But and then my other question is always, why should people not be hesitant, to be quite honest? Yeah. Just because we prescribe a medication to a patient, just because we tell them this is what they should do, why should they not be hesitant about it? And you're talking about a medication or a chemical that is going into your body. I think people should ask questions about it. And so I have been a bit dismayed at the conversations that I have heard in the judgment put upon people that do want to wait. There are several people that for instance, in our county, we of course had access to the vaccine as soon as it obtained its approval back in December. And there were only a handful of people that wanted the vaccine at that point. There maybe just a few. And most people were just thinking, wait a minute, this, it just got this emergency approval, and I don't think I want to be the first one to get the vaccine. So, which I think is a reasonable response to a person. However, over the last several months, more people know friends and family that have gotten it, and so many people now have gotten the vaccine that initially were extremely hesitant. And I think that makes sense to, there's a theory of acceptance of not just medication, but of new trends in general. And there are always going to be the early adapters, people that as soon as the iPhone comes out, they're going to grab it. They don't care. They don't want to read about it. They are just going to grab it. And then the majority of people take a wait and see approach. As soon as I see that it seems like it's okay, then I'm fine with it. And then you're always going to have a few people at the other side of the bell curve where it doesn't matter what you tell them. It doesn't matter how much information you give them. They are going to still be skeptical. So most people I feel like are maybe in the middle where they took more of a wait and see approach. There are still a lot of people that are hesitant, but my approach is always to just give people the information and explain to them, this is what we know and this is what we don't know. And you have to be honest and tell people that, you know what, we just don't know everything right now.
Right. Yeah. I think it's important to tell them the truth and give them the facts, as you just said. Before I leave you, in our due diligence, getting ready for today's session, there was something that I wanted to ask you about your use of the health belief model, I believe it is,
all right,
in your work. So could you give us a rundown on that, please?
So I'll give you a quick rundown. So this is a model that has been around since around about the 70s, and it's something we study in public health school and learning about health behavior and health education. And basically there are different steps. There are some variations, but it takes into account how susceptible do people believe they are to a given risk? So for instance, if a person believes that they are at great risk for having COVID and getting very sick from COVID, then that is going to make them more apt to most likely get a vaccine earlier than the general population. It's going to make them take on certain behaviors such as maybe trying some medication trials, that type of thing. But if a person believes that they're not at risk, because I've had people say that, they say, well, you know, if I do get COVID, then I'm probably not going to get sick, or I'm probably not going to die. So, you know, I'm just not that concerned. So if a person does not believe that they're susceptible to COVID or to some other ailment, then the likelihood that they're going to take certain steps to prevent that are lessened. And that's basically what the health belief model is what is your perceived susceptibility and what are the perceived benefits. So if I do get this vaccine, then how is my life going to be different? So if a person perceives that, because there are certain people that as soon as they get the vaccine, they believe that their life has just opened up completely and they can just do whatever they want to do and they're ready to take the mask off and go everywhere. So their perception is that it's going to have a great benefit. Then there are other people that think, well, the benefit isn't that high because I'm probably going to get really sick for a few days and I don't want to deal with that. And I still have to wear this mask. So what's the benefit really of me getting the vaccine? So that's a brief rundown of, and then also it takes into account barriers. So what are the barriers to taking on said behavior? You know, is it going to take me a long time to wait in line to get the vaccine? Do I have to pay for it? And especially with other types of medications, you know, do I have to get transportation to go and get this medication? How much does the medication cost? So those are perceived barriers that a person could possibly have. And I would say that is the essence of it. And when I'm working with patients, then I try to assess some of that. You know, if a person has diabetes even, and they say, well, you know, because I do hear this from people, they say, well, you know, I feel, you know, I know my blood sugar is, you know, 250, but, you know, I feel good. So, you know, what's the problem? And so their perception of their risk is low, that they have a low risk of some major ailment. So that person is going to require a lot more education, a lot more cues that you're going to have to give them to explaining what their risk actually is versus what their perceived risk is.
Right.
Just a quick rundown.
So is it accurate to say then, Cynthia, that you're deploying this model with all of your patients?
Not in an official way. Right. With most patients, it's always, I would say it's definitely always in the back of my mind.
Sure.
Especially when there are patients that, you know, we have the word non-compliance in medicine where, you know, the patient's not, you know, they're not following directions. So why aren't they not following directions? So it's always in the back of my mind to take all of this into consideration. If a person just, you know, if you're clearly looking at their lab values and you're alarmed by it as a provider, but your patient is not alarmed at all, then you have to take into account, okay, let's go back, let's take a step back and figure out why it's not quite conveying to them the seriousness of it. And it definitely, for me, goes back to this model. And this, like I say, this is not a medical model, unfortunately, but I think it's something that really needs to be incorporated into medical education, but because it's definitely in public health education, which is where I initially came across it and was using it as a health educator, but it definitely informs most of my visits.
Nice.
Yeah, I was going to if you don't mind, I was going to actually comment. I think that's very, very insightful. And I think, what's also interesting, Cynthia, is when you ask patients where they get, what's their source of truth, like what's their source of information. It's interesting how misinformation can perpetuate more misinformation. So it's also interesting. You probably do, but I'm sure you must ask them, like, where did you hear that? And it's interesting sometimes to hear, like, from your patients where their source of truth is, and how that person came to the conclusion they did about their health, or their unwillingness to do something, or their willingness to do something. So I agree with you. I think it should be part of our conversations, especially now as we talk about, what's the truth in what we hear in our, especially, with social media and stuff, like, what is the truth really, and how that is important and shapes our medical decision making, both as a provider and as the recipient of the care. So that's very interesting.
That's a great follow-up. Tina, didn't you have a question, I think?
I'm muting. Sorry. Yeah, I had a quick question. We're coming up from time, so I'm not going to linger. But just a quick question with regards to the model that kind of was curious to me. Is this more of the individual level, or is this taking into context this the environment, or multiple levels?
It's more of an individual level, but in all of that, it takes into account the social environment for that individual. So I think it can be used on a larger scale, for instance, in an organization where, people are maybe in a similar type situation, but originally designed more for individuals.
Because I was thinking, as I was hearing you talking through the model, that it would be very, very cool if that was also as social determinants on health were considered within that model, because then you would have actually much more of a complete picture, right, of why this susceptibility may be, even what is impacting that just beyond the individual level in terms of just psychological, right? So I was very interested.
It actually does take that into consideration, because like I said, it was developed in the 70s and there's been some changes to it over time, but it was designed to actually get at those social determinants of health. So to, again, understand where the patient is, where their level of understanding is, where it starts at, and where they perceive they are, where they perceive they're going to be if they do a certain thing. So it actually does take that into consideration.
Yeah. It sounds like we need to pull that out and really brush that up and really implement it into today's
I really find it helpful. I find it very helpful.
I can hear. Yeah. Awesome. Well, thank you for sharing that. Thank you so much.
Okay, guys, we're getting close to time. So I have one question that I want to go around very quickly and get your input on. Anu, I'll start with you. Are there any strategies from Blue Cross's perspective moving forward that are going to be new as we maybe get out of this COVID stuff that we've been in for the last year and a half that we should be aware of?
Yeah, so I mentioned, some of the investments we've made to try to be collaborative and improve access and care to patients. I'd say, interestingly, people may or may not be aware that we talked about telehealth, that we've actually covered telehealth for 20 years now. It's not a new service that we cover. So I think one of the new things is that patients and providers have both sampled telehealth. Some like it, some don't like it. So maybe this would be a way to continue to improve access within the community, especially for areas where there are limited providers. I think there's a national dialogue now, which I'm so glad and I applaud, about being mindful and taking into account our mental health and our behavioral health. And I think that's gained a lot of momentum through the pandemic. So I think that's a positive step forward for overall health. And then I would probably say that I think a lot of people have, hopefully over the last year, have taken up positive habits, like improving their exercise and sort of improving their well-being, I hope. And so hopefully these habits can be permanent in the future, as we've had the opportunity to recognize the importance of them.
Super, thank you. Michelle, what about you?
I think that what we are seeing is that we've seen come out of the pandemic is a response to try to support kids, families, and communities at a level we've never seen before, at least I've not seen before in my career. So when we look at the American Rescue Plan, the President Biden's proposal around infrastructure, we are seeing enormous support for childcare, for healthcare, for basic infrastructure in our communities that we know families need to be able to access to raise healthy children. I think we are seeing a shifting. The pandemic has really impacted families, particularly working moms, forcing them out of the labor market. And if we want to get people back to work, if we want families to be able to be healthy, then we need to make it easier to raise our kids. And so things like paid family leave, things like the child tax credit, which is estimated to lift almost half of our children out of poverty. These are really important public responses to the crisis, the public health crisis. And I think what we're seeing is really broad public support for those proposals, which we've not seen at that level in the past. And so I'm excited to see that happen and move ahead in the future.
Super. Cynthia, I've got about 15 seconds. Sorry, I'm over time. Would you like to say something? Okay.
But just moving forward, I think we're most likely going to continue some level of telehealth, especially in our behavioral health. And then just to say that I don't think any of us completely know the impact that all of this is going to have on our patients' lives. But one big impact is we're going to see is in the mental health area, where I definitely see us being just already affecting patients.
Super. Well, I want to thank my guests first most. I want to thank my colleagues. I want to thank all our listeners today for being patient with us. We've gone over the power hour, so we'll look forward to seeing you guys in 2 weeks. Thank you very much.